Welcome to the Minnesota Dance Medicine's Ask the Experts series. I'm Cari Stemmler, and today we're going to be talking about the deep core musculature and the deep hip musculature, and how what that is, first of all, so that you guys get an image. And I have this is Francois. And Francois is going to be co-teaching with me today. He has donated his body to science, and he's going to be holding the muscles. Okay, so what I want to do is give you guys a visual, three-dimensional picture of the muscles that we're trying to get to, and then we'll do a movement piece where you can apply that knowledge and find deeper places in your body that will end up helping your movement quality. Yeah? Come on in. Hi. So first of all, do you all know what the Minnesota Dance Medicine Foundation is? How many of you don't? And have you been to a conference or? Yeah, some of you? Most of you? Yeah? Not yet? Next year. So we are a nonprofit group that's dedicated to the research and education for injury prevention for dancers. And we hold a conference once a year. And this next summer, we're going to be doing more of an experiential workshop-y type conference for the dancers. So you'll not only get to hear speak, but also get a chance to do a little bit more movement and apply what you're learning, okay? And for me personally, I have been a dancer my entire life, probably like some of you, and I danced professionally for about 15 years. And when I was young, I had a lot of doctors telling me that I had to stop dancing for this or that reason. Oh, that hurts? Well, you're just going to have to stop dancing. And so I don't know how many times I heard that, but I didn't listen, and I kept dancing, and things worked out just fine. So for me, I have a personal interest in helping to educate dancers and dance teachers, and also doctors and PTs and medical professionals about what dancers do, and then dancers, how we can prevent injury and move into understanding what we can do, because about 80 to 90% of injuries are due to overuse. So that means there's a lot we can do in terms of strength and conditioning and prevention. And learning some of those things as a young dancer can be very powerful wherever you're at in your career, dancing or teaching. It can be very, very powerful in the longevity of your career. Does that make sense? So that's a big reason why I'm involved. I've been doing dance medicine probably since 2004. And I trained with the Harkness Center for Dance. I trained with MJ Liederbach. And she is the queen of dance medicine, and so I was very fortunate to get to do that. I'm also a Pilates educator. I teach instructor trainings throughout the country, and I own a studio called Paragon Pilates and Physical Therapy, where we do education of all kinds, as well as Pilates, physical therapy, and dance medicine. So that's a little bit about my background. Francois speaks for himself. He doesn't need an introduction. Hi, come on in, Betsy. And what I would like to know is a little bit about you guys, to know where you're coming from. So if you could just please go around and tell me your name and what type of dance you are currently doing or studying, and if you're an enthusiast or a professional or a teacher, let me know that as well. And why don't you start?
My name is Megan. I dance ballet, jazz, musical theater, lyrical, and I'm also a ballet instructor.
Okay, great, fantastic.
Young, mostly ballet, some jazz. I'm a hobbyist, I would say.
Okay, yep. Great, dance is for everybody.
Right.
Doesn't even matter, it's just good for me to know.
Exactly.
Yeah, go ahead.
Deirdre, I teach ballet and yoga and also lyrical, and was a professional dancer for a couple years, just teaching that.
Okay, wonderful. Don't dip your toe in it every once in a while? Not anymore?
Not the last 10 years.
Okay, all right, that's good. Go ahead.
I'm Amy. I have a background in dance all through college. Now just take class here and there, but I'm a physical therapist. So I work in pediatrics with some of the dance population.
Ah, how old? How old?
I range 2 months to 16 years old.
Okay, that's a big range.
Pilates and yoga background that I bring to my PT practice too.
Ah, nice. Fantastic. Go ahead.
I'm Nina. I do mostly ballet, a little bit of modern, and
You're a student still. Yeah, great.
I'm Mia. Nina. Ballet.
Ballet and modern?
Yeah.
Okay, and you're still a student as well? Okay.
I'm Ashley. I do mainly modern, West African, some ballet, and I'm also a student.
Okay, fantastic. We were going to have an African dance troupe before the thing, and they actually got stuck in Uganda, and they weren't able to leave the country yet, and so they're not here yet. So that was unfortunate. You would have loved that, but next time. Go ahead.
I'm Brittany. I'm a senior athletic training student and dance major at Untitled right now. I wanted to go into dance medicine, obviously athletic training, working in performing arts. Currently, hopefully, I have a job interview. Well, I do have a job interview at OSR Physical Therapy within the next month to be an athletic trainer there.
Well, good luck. Good luck to you.
Thank you.
Do you guys want to introduce yourself? Betsy, you want to?
I'm Betsy. I'm another one of the Minnesota Dance Medicine Foundation clinicians. My background is a little bit of everything, but mostly Irish dancing, and I'm a physical therapist. And I'm Julia. I'm another physical therapist. I work with one of the other family members, I think.
Meredith?
No, Jennifer.
Jennifer. Oh, good. She told me you were going to pop in.
And, so I'm
Oh,
a
good.
physical therapist, and just kind of here to, I've done some Pilates, so I'm just kind of interested in learning more.
Yeah. Okay. Great. So for you three that walked in late, we're going to do a little bit of, this is Francois, and he's co-teaching with me, and he's going to demonstrate some of the musculature first, so we learn about the muscles, and then we're going to go into movement piece to apply those things. Okay, so one more quick announcement before we get into all this. Betsy, right there, is actually going to be teaching in October of this year, and so I also brought a sheet for you guys to see the upcoming events. So we have Dr. Suzanne Hecht is going to speak March 15th. She's doing preventing and treating stress fractures in the dancer. And then Linda Muir and Jonathan Reynolds are going to present prerequisites for partnering on Saturday, July 19th in the summer. And then Betsy's going to do a piece on preventing injury in the Irish dancer. There are very specific techniques for that, and that'll be in October. So I'll leave these for you guys to grab at the end. Yeah? Okay, so you guys can come closer for this first piece, and we're just going to kind of sit on the floor and talk about muscles and bones. So how many of you feel like you have a really good handle on anatomy? You and you guys, of course. Okay, I hope so. I hope so. Okay, so good. You know, it's great to have some foundation, and my purpose is to help you go a little bit deeper. Some of this might be repeat, and some of it might be brand new information. But either way, I hope you learn a little bit of something. First, we're going to talk about the core, and I teach a course in anatomy called Anatomy in 3 Dimensions, or Anatomy in Clay. And I pre-built my muscles because I'm not going to sit here and build muscles for you. But the green is going to be fascial material, and the brown is musculature. So the first thing we're going to do is put on our fascial lines. So this is a little bigger than it is normally, but this is called your Linea Alba. And it's the fascial line that runs right down the center of your abdomen, and all of your abdominal muscles connect into that. Well, the rectus and the transverse. The obliques don't really so much. And then this is your inguinal ligament that runs right about there. So this is your transverse abdominis. So notice it is scaled to size, okay? It's pretty big, right? Scaled to size. So it runs from the base of your sternum all the way down to your pubic symphysis, and then it wraps around your rib cage and over the top of your pelvis and your ilium, and then it connects into what's called your thoracolumbar fascia, or your thoracodorsal fascia. And that is a big, thick fascial sheath that prevents your spine from bending forward too much, so it doesn't collapse, yeah? So this muscle attaches right into that fascia, not in such a clean line, obviously, but it kind of bleeds into the fascial tissue. And so this muscle, first of all, it's the deepest of your 4 core muscles, and it's the largest, and it's the most encompassing. So it wraps all the way from here around into the fascia and into your spine, which means it has a huge effect stabilizing your spine, your low spine, okay? And a lot of times, well, this is also a postural muscle. It should function when you, even before you get up to stand, okay? And notice that I drew the fibers on already for all the muscles. Notice that the fibers start here and they kind of fan out in all directions. And they're running basically horizontally, meaning that when that muscle activates, and we'll do this when we do practice, it literally narrows your waistline. And a lot of times, and it does make you sit up taller. Yeah, so literally when it activates, because it does kind of fan like that, it also elongates your spine. So when you're standing up at the bar, for example, and you are taught to lift, you're getting this guy, hopefully, okay? What I see happen in dancers a lot is the underutilization of this muscle and the overutilization of the hip flexors and your rectus abdominis. And what that does is it kicks in your big back muscles, and then you don't have your core working properly. Does that make sense? So we have to think to get this muscle. If you're just doing choreography and you're just going for height in your leg, or speed, or you're coming on and off the floor and you're not thinking about it, it won't necessarily activate. I mean, it should in function, but a lot of times what I've found with dance is that dancers are really good, and I can say whatever I want because I danced professionally for a long time. Dancers are really good at making it happen, whether they have the facility or not. Does that make sense? So we say, oh, well, my friend Susie can do blah, blah, so I can do blah, blah. And I can just make that happen. But different bodies have different abilities and different capacities. And we have to think about the idea of training in order to dance instead of dancing in order to dance. So finding the right muscles to work from. Okay, so that is your deepest core muscle. And then we have internal obliques and external obliques and your rectus that goes over the top of that. So they're considered more surface musculature. Okay, so now we're going to move into the deep hip musculature. And this is your hip, and on this skeleton it's fixed together. But this is what we're looking at. Whoops. Good afternoon. Hi. Some of these guys know 17 things went wrong within the half an hour before this started. So forgive me if some things like that happen. Okay, so this is your hip. This is your femur, and this is considered the head of your femur. And it fits into this groove called your acetabulum of the hip. And they fit together like that. And here's the deal. the muscles that we're going to build in the deep hip rotators, basically, part of their job is literally suctioning the femur into the hip joint to create the hip joint. It's kind of like your inner unit or your deep core of your hip, right? And then the bigger muscles layer on top of this. But the deep six hold and stabilize this joint, okay? And you guys can play with the bones. If I pass them around, you can play with them. So the first muscle we're going to build are your obturators. So, hold on. I have some clay sticking together here. All right, so the first one we're going to build is called your Obturator Internus, and it's on the inside of your pelvic rim, really. And it goes from your pubic symphysis through the hip. So this is your PIIS and your sits bone. And it's going to attach onto the femur bone, like that. So it lies deep in your hip, and the fibers run horizontally. So if you can imagine on the bigger set of bones, it's going from inside your pelvis and kind of grabbing the femur and pulling it in, yeah? So that's your Obturator Internus. Your Obturator Externus, I'm going to lift up his abdominals for a second, are going to go on the external portion of your pelvis in the front, and it's going to attach again. Is there somebody's phone?
Yeah, that's mine. Sorry.
Yeah, if you guys could turn your phones on silent if they're still on. That's a catchy tune though, I gotta say. If you have to have a cell phone go off. One of my clients has a loon call for her phone, and I'm like, you're the only one that gets to leave your phone on in the studio. It's beautiful. Okay, so anyway, this is our Obturator Externus, and it runs from the anterior portion of your pelvis through to the back. Okay, so that's the big deal there, okay? It's going to go through the hip, and it's going to fishtail up and still connect onto that same part of your femur. So we have like a little hammock for the pelvis that is holding the femur into that socket, yeah? And again, the fibers run horizontally. So those are your obturators, okay? Then next we have our, what I call the chicklet, because it looks like that, and it's the Rectus Femoris. And it literally is a teeny little guy that's going to attach your sit bone to your femur, like that. So this is super teeny and super deep. And the thing about teeny short muscles is that they can get incredibly strong because they don't have a big bandwidth to stretch. They're very short, and so they're very good at just like holding something in place. So this is a deep hip stabilizer. For example, if you're doing a dégagé to the back, have any of you realized that it's harder to close to the back than to the front? This is kind of why. You know, because we have to get into these deep little muscles, and they're hard to access. They're really great when they are accessed and they are strong, but a lot of times they're just not conditioned well. So that's why it's important to have a good ballet teacher. Okay? So that's that guy.
This is the ballet teacher, by the way.
Her? Yeah. Oh, you are the ballet teacher. Oh, I thought you were.
But I teach that.
Oh, it's your ballet
I
teacher.
have like one class.
Ah, okay. Yes, I was referring to you. You are the good ballet teacher. Okay, even though I just met you, I can tell. What?
I'll say, you've talked about
Oh yeah, but I haven't.
That's why I was thinking that. Her anatomy lesson.
There's some validation for you. You can take a bow. That's great. Okay, so now these are your gemelli. And they are going to go from these two bony landmarks to that same portion on your femur. It's getting a lot of attention. Okay? So there's your gemelli superior. And here's your gemelli inferior. Okay? And they also what? Grab the femur. Pull it into the hip joint. So when you're standing, for example, and I have one more to put on, but when you're standing, for example, and you're doing a coupe or passe or whatever you're doing, if you're sitting into your hip, none of these muscles are working. None of them. So that's why we don't do our passe like this. And if you try to turn like that, you fall over, right? So we have to, and we'll do this later, but we have to pull these muscles into the hip joint and work your standing leg. Has anybody heard that? Work your standing leg. What does that mean? What the heck does that mean? It means this. It means work these guys. So we will do exercises that are not dance to find them, to work them, and then we'll stand up and do some passes, some maybe développés, dégagés, thing like that, so that you can feel it. Okay, so then the big guy around here that gets lots of work and lots of attention is your piriformis. So lots of times this one, notice it's considerably bigger, is what I call a bully on the playground. So the bullies on the playground are the big guys that don't let the wallflowers play on the playground. So bully, wallflowers. Okay? Also, wallflower. Okay, so this big bully is your piriformis. We'll be nice to it now because it helps us with passe turnout. It is the only one of the deep six that actually attach to your sacrum. So now all these guys attach just to your hip joint and they hold and stabilize your hip joint. This guy attaches to your sacrum, which is the bottom portion of your spine, and also comes around right over the top of all the rest of them. Okay? All the muscles of the deep six have fibers that run horizontally. So they're all working together. They're like a cooperative, hopefully. Hopefully, if this one doesn't get to be too big of a bully. Okay? So, any questions on your deep six musculature? Does that make sense? Yeah, yeah. So I'm going to just put Francois in the center so you guys can look a little further. And you can also, if you want to peel anything off and put it back on, you can, just for experience. Don't be shy. You can just get right in there.
The obturator and Linea are also rotators as well as stabilizers, right?
Uh-huh.
Piriformis.
Yep. They all rotate the femur in the hip joint as well. So they are your turnout muscles as well as your stabilizers. The Obturator Internus I think is also an internal rotator. Is that right, PTs?
I think with that 90-90 rule, so when you switch up to 90 degrees of hip flexion, then they will become internal rotators.
Then they become internal rotation. Okay.
And then I heard something at the last one of these that I went to that I had never heard before, which was that most dancers want to use the piriformis to turn out.
Yes.
But that you really want to use the obturator and the Linea more than the piriformis.
Yes.
Because why? Because it's like it pulls your hip joint up higher or something? I can't remember exactly. I mean, I
this is
kind of
good.
visualize it, but...
Yeah, no, this is good. Mainly because, again, the piriformis is impacting the spine,
Okay.
and the gemelli and the obturators are impacting your hip. So first of all, they're more powerful external rotators. They're just harder to access. So you have to really train to access it. As well, the higher the leg is, the more the piriformis is going to come into action. So for example, everybody stand up. If we're just, and we'll just use one foot, doesn't matter which one. If you are just rotating in a straight leg standing position, this is going to be more that rectus femoris and your obturators. And then if you go to a coupe and you do the same thing, we're going more into obturators and gemelli. And as you get higher, it's a little more gemelli if you go midway between passe and coupe. And if you're all the way up in passe, that's your piriformis. Okay, so they work at different levels to rotate the hip. Don't get me wrong, they're all working all the time to rotate that because they work together. The reality is we can't isolate one over the other. It's just what, oh, Betsy found something. I saw that face.
Hip is getting bullied on the playground.
Yeah, yeah. So, but if you guys try that a couple times, so let's go straight leg turn out. Let's do the other foot. So whatever foot you did before, do the other one. So straight leg turn out. Try to find that place deep in your hip, that little chicklet that just goes from the femur to the hip. And then take a coupe and try to find a little different place in your hip, but still deep. Okay, so those are more the obturators. Remember, they make a hammock, the front and back of your pelvis. And then go midway between coupe and passe. And you'll start to feel your gemelli. They're more deep in your booty. Feels like you're working your booty a little more. That's the technical term, in case you're wondering. And then way up high passe, turn out, that's the piriformis. You feel the difference? And you do actually kind of feel it stripe across your butt a little more. And that, try not to do your low back. Try not to do. So you need TA strength. Right. And so did everybody hear what she just said about her low back? So that is what tends to happen, is that in order to either get your leg up higher or turn out more, dancers do that. And I'm not saying you were doing that. Oh. Okay, yeah, yeah. So, you know, I don't make these things up, right? Yeah, yeah. So we have to learn, the reason you feel it in your low back is because A, these deep six muscles are not strong enough, or B, your core is not strong enough. And so what also happens when we force that and arch our back, not only do we get back pain, but where are my ribs in relation to my pelvis, right? It's like way forward like this, okay? And so if you look at Francois from the side, he has his rib cage directly over his pelvis. And that's how we all aspire to be like Francois. So he's not doing a passe, so that's not fair. But even if you're doing a passe, you need to keep your ribs back over your pelvis, and then you won't feel your back. Does that make sense? Work standing leg, work the turnout, work your core. Those are all these muscles that we're talking about. So you have to work it together, like a community. Okay, does that make sense? Yeah. And then the positioning of the pelvis. You know, even if you're way up there, everybody do like that again, turn out, you don't want to be hiking your hip up, right? Because if you're hiking your hip up, then you're going into your back as well. So if you find your frontal hip bones, you want them to be level as much as possible. And then on your standing leg, find those deep six. Okay, good, you found it. Yeah? And feel that it suctions your femur literally into the joint. You guys feel that? Yeah, shake out your hips a little. Yeah, stretch them. Okay, we're working already. Okay, so any other questions on the anatomy piece before we do movement? Yeah?
So as far as teaching dancers to feel those rotators on their standing leg rather than the one that's up in the air, do you have any tricks for that? You know, like how to feel that rather than gripping your butt to feel that rotation from way down under?
Sure. You could teach them in parallel because unless you're doing modern, like some of you guys are, that's a very unusual position for dancers to be in if they're training ballet and jazz a lot. And so if you bring yourself into parallel, and you can use the mirror as well so people can see. And again, you just come up parallel passe and allow them to sit into their hip and see what that feels like. And then literally suction the femur into the joint and lift up. So if you teach that motion, the difference between, okay, this is what it feels like to sit in your hip, this is what it feels like to lift up out of your hip and use that. And then feel your booty and make sure it's not gripping. Do you know what I'm saying? So an explanation of that difference, and then you can apply it to turnout. Same thing. Sitting into your hip, suction in the femur bone. It literally is like suctioning. It's like you're pulling it in. That is what your muscles are doing. Does that help? So think of it more as, it's not necessarily an exercise or a movement it's more of a concept and part of the technique that they're going to use whatever. Frappe, whatever you're doing, doesn't matter. That's going to be it. But I find it very effective to allow people to go into the cheating place that they want to be and then start to feel the difference of the proper positioning. It's harder to keep that. That's what you found, right? Can you tell them what you felt?
I don't know. It just feels like it's working more underneath than it is on top. I don't know.
Perfect. Perfect. That is exactly right. Because these muscles are more underneath. And it is working your hip versus your big glute muscles. Yeah, because those are bullies too. Unless it's your glute minimus. That's not a bully. Does that help?
So I have one more thing.
Sure.
Had a hip injury myself, still have. Went to see Mary Ann.
Oh, good.
I used to dance with her good friends.
Yes.
But anyways, she was saying that I was overdoing that. So I was lifting up too high and that I had to sit into my hip more.
That could be.
So now I'm cautious with teaching because I always was really a big proponent of lift out of your standing leg, and now I'm just like, well, maybe I shouldn't say that too much, so I don't know.
Yeah. Well, I think that's a very good question, and I think it has to do with training your eye as a teacher to see the difference. So I would say 9 times out of 10, people need to learn how to lift out of their hip joint. That 10% needs to come back down to a neutral, moderate place. So for example, we can overdo anything. So how many times have y'all heard put your shoulders down? 5? You can count them on one hand, right? No. Okay, so put your shoulders down. So let's do that. So put your shoulders down and then put them down too far and then try to lift your arm. Right? Now lift them way up and try to lift your arm. Okay, now find the middle place between those two where I'm going to give you a little image. Pretend you have little balloons under your armpits. Good. And they're just kind of floating up your shoulders and your scapula. And now lift your arm. Ha! So it's like the 3 bears, right? Not too much, not too little, just right. So that applies to every single joint in your body. So you can pull up too far out of your hip, and then you're pulling on your adduct. Ouch. you're pulling on things that shouldn't be pulled on, right? And Marianne was right. If you need to do that, you need to soften the inner portion of your hip to find neutral. But that doesn't mean you're overdoing it again in this direction. It's what we call a co-contraction, where both sides or all sides of the joint, the muscles that feed into all sides of the joint, are working evenly. And then you have a stabilized joint. So that's not easy to teach. And then what I'm saying, and also for the PTs and people that are working with, working with athletic training. So the people that are working with people to find the right place, you guys have to train your eye to see what is the proper alignment. Knowing what that means in your head, but then also being able to see it on different students' bodies, because we're all built differently. So it'll look different. And I would suggest to get used to looking at bony landmarks. Really try to look through to the bones, and then that's going to help you. So if you have proper bony alignment, a lot of times the right muscles are going to work, whether you can talk about obturators or not. Do you know what I'm saying? 9 times out of 10. Not always, but that would be a skill to develop. That would go a long way. Yeah. And I think people with dance backgrounds are particularly good at that because we're used to looking at alignment and form. And we're used to looking at alignment and form in motion. Yeah, that's not an easy thing. It's very difficult. And I think dancers get good at it because that's our world, that's our realm. That's what we're looking at all the time. So you're already, way ahead of the game. So, does that help?
Yeah.
Good, good. Anything else from any of you other teachers or students? Making sense? Okay, good. So, and then as a student or a professional or whatever, it's your job, our job, to look at our own alignment and not always rely on the teacher to correct it. And the more you know, the more you can correct yourself. Yeah. Okay? Yeah. Do you have something?
No, I was just playing with some things.
Finding, yeah. Okay, so then if we just talk about our core one more time, a big tendency of dancers, again, is to rib shift forward, right? Not as much as gymnasts, but we do it, okay? And so if you all just put your hands on your belly and stand however you want, doesn't matter. And if you rib shift forward, I just want you to do that and then feel what that does to your back. Feel how that overactivates your low back muscles. It doesn't feel so good, does it? Yeah. And flares your ribs out and all that other aesthetic stuff that we don't want to see. But it has an effect on your musculature. So then if you think of this big transverse, right? And if it's active, it's going to envelop your ribs and pull them back over your pelvis in a very deep way. We're not going, oh yeah. We're not, clamping down on our bodies. You're literally just capturing your rib cage and pulling it back. So many people are front oriented and we're just in a hurry all the time, right? So people are like this, I gotta go, instead of like staying back and just leading from your pelvis, even when you're walking. Do you know what I'm saying? So notice that even when you're walking. All right, so now we'll do some movement, and this is a very nice floor, and you guys are all used to being on the floor. So if you're comfortable on the floor, just grab a piece of floor. If you want a mat, there are some back there, and you're welcome to grab those. Okay, I'm going to clear this space. And all of you are going to grab a ball and a TheraBand, and hopefully there are enough. If they're not, you guys don't get one. Okay. I'll put these over here. first thing we're gonna do is I want you guys to lie down on your backs. I need some water. Does anyone need water before we do this? It's really dry in here. Okay. All right. So the first thing we have to do is find our neutral spine when you are lying on the ground. So you're going to take that ball and you're going to place it between your knees. And then I want your, do you have a rolled up towel or a sweatshirt? Yeah, roll it up and make it about this big. Yeah. Or you guys can roll up the little mats or the big mats. Yeah, because it's good to feel this alignment. And then I want your heels in line with your own frontal hip bones. So find the ASIS, 2 pointed bones on the front of your pelvis with your hands, and then make your feet be in that line, like they're on a train track. Okay? And I'm going to come around and put you in the right position if you're not. Okay. A little like that. Good, good. There you go. Okay, that looks pretty good. So, you're going to have a little light squeeze on the ball or whatever you have between your knees. Not a heavy squeeze, but just you're holding and you're active in your inner legs, okay? And then make a diamond with your hands like this. Place it on the front of your pelvis. And you're going to tuck your tailbone under a lot so that your fingertips are higher than your thumbs. And then you're going to do the very opposite and bring your tailbone to the ground and make your thumbs higher than your fingertips. And do that again. So tuck under. This is called a posterior pelvic tilt. And if you reverse it, it's called an anterior pelvic tilt. So once you do that a couple more times, posterior pelvic tilt, anterior pelvic tilt, one more full round, posterior. Good, go way anterior, and now relax from there. Good, so you're neutral, your fingers and your thumbs should be in the same line. Like if I set a hot cup of tea on your hands, it wouldn't spill all over your belly. Okay, other way. This way, this way, this way. Good, keep that. Okay, hang on. No. So keep a neutral and then adjust from your rib cage, like we talked about in standing, okay, instead of from your pelvis. So a lot of times dancers will feel an arc in their back and they'll adjust from their pelvis. And I want you to adjust from your rib cage. Pretty good. I'm going to bring you this way just a little. Good. And then pull the transverse in. Good. And then open the shoulders. So the shoulders, ribs, and pelvis are all going to fight each other. It's like if the shoulders go back, the ribs go forward. If the ribs go down, the pelvis goes under. If the pelvis goes right, then the ribs go out. Do you know what I'm saying? It's like one of those punchy dolls. And you want all the 3 points, shoulders, ribs, pelvis, to be in a flat line, like you were on a tight wire or something. And if one of those 3 points pops up, you're going to fall to your death. Don't be scared. We're just having fun. Does that make sense, though? Yeah? So when the shoulders pull back, everybody try to flatten your scapula into the mat. And now everybody try to pull your rib cage down towards the floor. And then I want you to feel your tailbone on the floor. And that's called neutral pelvis or neutral spinal alignment, which is what you have standing up, but it feels different lying down because we all want to tuck under, right? Because that's what we learned in 5th grade gym class. That was what we're supposed to do, but now we know better, okay? So, good. So this is your neutral spine. Keep it for the rest of the day. We might do some spinal motions, but understand what it feels like to come back to neutral, okay? And now we're going to do something called grounding, which I describe as the clicking in of all of your musculature around a neutral spine and neutral legs. So arms are going to be by your side, and just follow along with me. So I want you to breathe normally, okay? You're going to actively plant your feet into the mat. Actively squeeze the ball between your knees. And now without moving your feet, pretend they're stuck in wet cement. Try to pull them towards your sit bones, and then pull your sit bones towards your heels and feel your hamstrings activate. Draw up through your pelvic floor. Draw the transverse abdominis in by narrowing your waistline. Draw the bottom tips of the ribs down. Draw the shoulders back and down. And then reach your arms long like you're trying to touch your heels. And then reach long through the crown of your head and your tailbone in opposite directions. And then let it all go. Good. Nice, you guys. Do that again. So keep breathing. Plant the soles of the feet. Squeeze the ball. Pull the heels to the sit bones and the sit bones to the heels. Lift up through your pelvic floor. Draw in through that transverse abdominis. Narrow your waistline. Tips of the ribs down towards your hips. Shoulder blades back and down. Reach those arms. Crown of the head long. And then release all that. So we're going to do 3 more times all at once. So no details. You ready? Breathe in. As you breathe out, all that. Your whole body's going to click in all together. Put it together. Good. Inhale, let it go. Exhale, click it all in. Keep your tailbones planted. Find that transverse abdominis. Good. Inhale, let it go. No moving your pelvis, my dear. Keep that there. Breathe in. Exhale, find that grounding. If you use your hamstrings to pull your sit bones towards your heels, that won't happen in your pelvis. You're still tucking, sweetie. No tucking. There. And rest. Does that make sense? You can't not engage it. Yeah. So every time she's connecting, she's pulling her pelvis under with her. So what do you think is overworking there? Her rectus abdominis. That's right. So the surface muscle is taking over. If you're truly just working your transverse, remember the fibers only run this way. They don't run this way. So that means you're using your rectus abdominis. Does that make sense? Yeah. So keep this down more. Breathe in. And now just narrow your waistline. Pull your sit bones toward there. Lift up and in. Up and in. There. Better. So we'll have to work on that. But it's a different sensation. Did you guys all feel a little different sensation? Okay, good. So now we're going to do, for sake of time, we're going to do bridging first, and then we're going to find the transverse. So first, I just want you to use the transverse like in grounding, okay? And then we're going to do some bridging and work your hamstrings, but put it all together, okay? So you're going to take a breath in, find your grounding. On your breath out, you're going to lift your hips toward the ceiling, keeping a neutral spine. Lift the hips up, squeeze the ball, and I want you to send your knees over your toes and pull your heels towards your sit bones. Good. And then gently come down, and I want all 10 toes on the ground. Good. And again. So fire that transverse first. Pick it up all in one piece, keeping your grounding. Remember your rib cage alignment. So the ribs go down and the hips go up. That's the sensation. And then gently coming down. So in other words, you're not flaring your ribs.
I feel like a sharp pain in my lower back.
In your back.
Left side.
Okay. So
It's usually I have a lot of lower back pain.
squeeze the ball. Now as you come up, use your tush. So use your glutes. Hang on. Tuck your tailbone. Don't lose that ball. Rolling up. Good. Tuck your tailbone, squeeze the ball, and pull in there.
Okay.
Is that better? Good. And then coming down. So a lot of times dancers push from their low back. I don't want you guys feeling pain in your low back. I want you to lead from your hips as you go up and find your hamstrings by pulling your heels, good, towards your sit bones. And then keep your core active, ribs down, and then you won't feel your low back. Do you guys feel the difference? I know you do.
You don't use your glutes.
Yeah, you use your glutes. Yep, this one you use your glutes a lot. But you stabilize with your core. Yeah. Try that one more time. Good. Lengthen. Good. Pull your heels to your sit bones. Lift your booty up. Ribs down. There. And try to elongate. There. And then come down, squeezing the ball. Kind of, sort of? Good. I know. Now you can set the ball aside. And we're going to find your transverse. So everybody's really good at keeping their pelvis stable, right? Go like this. Right. Okay. So you are going to keep your pelvis stable, meaning you're not going to tuck under. So we will use our rectus abdominis, but that's not what we're focusing on. Don't worry. It'll work all by itself. We don't have to pay any attention to it. So you're going to bring your hands behind your head, but I want you to do one hand cupping your neck, and the other hand lays right over top of it. Okay, so you're kind of like this. And then I want you to narrow your elbows, like they're in a little scaption plane, and then pulling your shoulder blades down your back. Okay, so lengthen the back of your neck, find your grounding, and on your exhale, you're going to pull your ribs down, 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 down towards your hips so much that your shoulders and head float off the mat. Good. And then inhale, come back down. As you come up, I want you to elongate. Exhale, curl up, elongate your spine, and now check your tailbone. Keep it planted. Inhale, come back down. Do a couple more, and I want you to narrow your waistline. Good. That's good, but you're a little tucked under, so go this way. And now curl up higher from here. So that tremble's good. You guys should keep going and feel a little shaky. Feel a little trembly sensation. Good. And down. So as you come up, Betsy, wrap. So pull in, curl, wrap, wrap deeper, 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 more. Go into that. Don't be afraid of the tremble. The tremble doesn't mean you're weak. The tremble means you're in your transverse. There, tailbone down. So try to find that little shake-a, shake-a, shake-a. Drop your tailbone for me. Good, and now come up. Keep it down. Keep it, From here, drop those guys. There you go. So, what do you think is working if your pelvis keeps tucking under on that? Rectus and hip flexors. Bullies on the playground. Okay, dancers don't need to really have any stronger hip flexors. We have a million butmas. We have, strong hip flexors. We need a stronger core, believe it or not, no matter how many sit-ups you do, okay? You need to find that transverse abdominis. So, we're going to build now, okay? Make sure your pelvis stays down, meaning the base of your sacrum, your very tail is on the ground. It almost feels like you're sticking your booty out, but you're not because you're keeping your ribs over your pelvis.
So does that mean when you come up, you shouldn't feel your low back?
No.
Pressing the floor?
No.
No.
Yeah. No. Try not to press your low back into the floor. I want you to pretend that across your rib cage is like a door hinge. Okay? It's called a chest lift, not a sit-up, because it's Pilates. And on your rib cage, that's the door hinge, and that's where I want you curling from, not here. It's not a contraction. It's almost like, for you modern dancers, it's like an upper back curl instead of a C curve. Does that make sense? So try that a couple times. So door hinge to come up, your tail stays down. Relax your hip flexors. I can't. Okay. Ooh, they're strong. Yeah. Okay, try to relax those guys. Now from your core, deep core, even more. Deeper, deeper, deeper. Pull in through your center and curl around your rib cage. Yes, better. So that's how hard I want you to work. That was better. Did you get it? Tailbone down. Good. Now door hinge. Better. Now let this go. Do that again. Better. You feel that little shake-up? That's good.
So, to not use your hip flexors and your back, lower back, how are you supposed to feel your tailbone stick to the floor?
Your hamstrings. So her question was, how are you supposed to feel your tailbone on the ground if you're not using your hip flexors, right? If you use your hamstrings to pull your heels towards your sit bones, it will keep your tailbone planted.
I can't even do that without my hip flexors.
I know.
Yeah. So if those hip flexors are overtrained, they're not going to want to listen to you today. But that doesn't mean you can't learn and, and then keep going. So do the best you can, and this will be something that will develop over time. It's not something that's going to change in a day, but your mindfulness around it will help a great deal in how you work. Because now we will use your hip flexors, but I don't want you to rely on them. Okay? So we're going to start the same way. Everybody feet in line with your hip bones. Hands behind, elbows narrow-ish, just diagonal. Now first, pull your sit bones towards your heels. Keep that neutral. Breathe in, breathe out. Door hinge up, hold. Stay up there, find that little trembley, and you're gonna float your right knee to a tabletop position and hold it there. And now bring the left leg up to meet it. Hold it there from your transverse. Good. Your right leg's going to come down. Keep that transverse firing. Your left leg's going to come down. Now your head can come down. Let's do that again. Breathe in. Good job, you guys. Woo! Exhale. Curl up. Find that transverse. You remember Francoise? It's big. Okay, one leg up. Tabletop. Now, narrow your waistline and bring the other leg up. Don't let your belly pooch. One leg down. Are you breathing? Good. The other leg down. And your head down. Lots to think about. Let's do that again. Breathe in and lengthen. Breathe out. Keep that tailbone planted as you come up. Inhale. One leg up. Good. The other leg up. Tailbone down. Use your core. Rib cage to hip bone. There you go. One leg down. The other leg down. And your head down. Keep going at your own pace, and I'm going to help you guys a little. So, drop this. More. Good. From here, sit up. There. Now come up. Better. You feel the difference? Kind of, sort of?
But my belly was...
Try not to pooch. There. Try not to. Do your best. Okay. Do that one more time. Good. Hold at the top. I'm going to have you curl higher, shoulders down, belly in. Good. Now, you're going to march your legs and just tap one toe down and then alternate your legs. So legs stay in the air, just tapping one down and then the other. Are you breathing? Breathe. Now, you can see your belly, so narrow that waistline. Good. And I want you to move from your hip joint, not your knee joint. Yeah, so your legs move away from you as they tap the floor. Better ones. Stay curled up. Keep breathing. Good trembles, everybody. I know you're in there. Good. One leg down, the other leg down, head down. Just rest for a second. Everybody feel it? Whew. Good work. So it's how mindful can you be? How much can you stay in your body and work your body in this way? And then when you come to standing, it'll be more natural. But you cannot do, 100 of these, right? So it's not like doing 100 sit-ups to the music. Like when we're in jazz class, we get to do that. It's fun. But it's true, right? But you're only training your rectus and your hip flexors then. I would challenge you, even if you are in jazz class having lots of fun, can you get into your transverse abdominus? Even if you can only do 20 and the rest of the class is going on doing 100, it doesn't matter because we want quality over quantity. Quality over quantity. It's very efficient. It's not like you have to do 1,000,000 sit-ups. Hooray. You can get on to working other things. Okay? So now we get to do signature Pilates exercise called the 100. And yes, you will stay in your transverse no matter what. Okay, you ready? We're going to start the same way. Now, I'll tell you before we start. The lower your legs are, the harder it is. So I don't want anybody lowering their legs and then, oh, there goes their belly. And there goes their whole posture, what we've been working on, okay? You want to keep the quality, and I'll challenge you, but if you've reached your limit, stay where you are. Do you know what I mean? I don't care if the knees are bent. I don't care how low they are. I care that you stay in your core, okay? So we're going to start the same way we did. Hands behind, shoulders down, tailbone down. Find your grounding on your breath in. On your breath out, float the head up like that door hinge, keeping your tailbone planted. Good. Breathe in. Exhale, pull one leg up. Pull the other leg up. Squeeze the legs together a lot. Now, recheck your door hinge. Curl up, plant the tailbone, and then reach your arms to your side, and you're going to pump your arms about 6 inches up and down. From your upper back. Find your upper back. Nice strong arms. Breathe in for 5 pumps. Breathe out for 5 pumps. Now, if you want more, straighten your legs to the ceiling. Turn it out into a little Demi first. And find your hamstrings. Squeeze the back of your legs. And now, if you can keep your core in, you can lower your legs any amount. Lower they go, the harder it is. But watch that core. Good. Stretch the legs long and stretch through the crown of your head long. Keep going and try to stretch your whole body like a rubber band, head to toe, head to toe. See if that can make you work deeper. And then hug your knees to your chest. Rest down. Good. How'd that go? You feel it?
Yeah.
Everybody felt a good abdominal work? Yeah. Okay, I swear that's the best abdominal exercise on the planet. You do that every day, you do it right, and you will get stronger.
The key is doing it right.
What's that?
The key is to do it right.
Yes, the key is to do it right. It's not easy. It's not. It's that mindfulness and the patience to keep finding deeper places, in a world of quick fix. This is not a quick fix. Okay?
Is there a way to relax your neck?
That's exactly what
Because for me, it's the neck cramps up, and I feel like I need to give some support. So is there a way to elongate without clenching those muscles in your neck?
Yeah. So you guys can try this if you want, or you can watch her if you want. Either way. Bless you. If you just come up into that position, and then bring your arms around to the side. So you want to feel like you're lifting from that door hinge. The more your ribs pull to your hip bones, the upper abdominals hold the carriage of your sternum, your rib cage, yeah? And then your head can kind of just float there. like a bobblehead, like you're in water. Yeah? And that's the sensation you want, is if you're working deep in your core, pull more here. There. Even if you tuck under a teeny bit, I'd rather have you do that. And then the other thing is you want to feel your upper back. It's almost like you're standing on the kickstands of your scapula. Like the bottom tips of your shoulder blades are like a little kickstand. Does that help?
Yeah.
Yeah.
So you can tuck slightly?
A little.
Okay.
If you need it. If you need it. You can also do the 100 in an imprinted position, but I swear dancers will just cheat in that position. We'll just cheat and hang on our hip flexors. So I'd rather teach this, and then if you need to do a little what we call an imprinted spine, which is different than tucking your booty under. It's not a posterior tilt. It's just a little pull from the core. And your spine moves a little. Does that make sense? Okay. But the neck is a big deal, you know, we're not used to that. And I want you to find a neutral spine on all fours. So, this is a good thing to do if you have a class and you're trying to teach people how to find their transverse. It's a little bit easier here because we get to work against gravity. And then I want you to find neutral spine on all fours. So I want neck in line with the spine, hands under your shoulders, knees under your hips. Shoulder blades down the back. Good. Good. Pull your ribs in. Not so much. Just a teeny bit. There. Good. Okay, now, I'm sorry. Take your ball. This is good. That's good. Take your ball, put between your knees. Here, you two guys. Thank you. And, okay, so we're going to do grounding and kneeling. And you guys look pretty good. So find your neutral spine. And the first thing you're going to do is you're not going to move your spine. You're going to pretend you're a pregnant kitty. And you're going to drop your abdominal wall toward the ground without moving your spine. Like you have 10 kittens in your belly. And then on your exhale, you're going to hug all 10 kittens to your spine without moving your spine. So don't move your spine, just move your abdominal wall. Yeah, there you go. So allow the abdominal wall to drop down. Fill your belly full of kitties. And on your exhale, there you go. Hug your kitties to your spine. Keep trying that a couple times. Good. And then as you pull your kitties up into your spine, there's your transverse abdominis. Try a couple more. Pull your ribs in just a teeny. Good. And then go without moving your spine. Feel the waistline narrow. You guys got it? Looks pretty good. Everybody feel it? Silence means yes. Okay, so now we're going to use the transverse abdominis and do grounding in kneeling. Okay, so keep your neutral spine no matter what. Breathe as you need to. Okay, you're going to actively squeeze a ball between your knees. Pull your belly full of kitties into your spine. And then actively draw your hands towards your knees and your knees towards your hands. And then lengthen the crown of your head and your tailbone in opposite directions, like you're being stretched out like a tightrope. And then relaxing that. And do that again. Squeeze the ball. Narrow your waistline. Find that transverse. Shoulders are down. Actively draw your hands towards your knees and your knees towards your hands. Long neck. Tailbone reaches away from you. And release it. Now, breathe in. Exhale, find that grounding. Hold. Don't worry about the ball. You're going to straighten your right leg back to a plank position. Plank. Tuck your toes. Toes on the ground. Push up position. And the other foot comes up to meet it. Push up position. Hold. Find your transverse. Draw your hands towards your feet and your feet towards your hands. Long neck, tailbone reaches away from you. Make sure your belly's pulling in and pull your scapula down and in. Good. And rest. Who saw that coming? Rest. Okay? Shake your wrists out, yeah. Or do like this. That helps.
Injury, so it's hard.
Yeah, if you need to do elbows, anybody, you need to do elbows, that's fine. You find it? Core? Everybody? That little tremble? It makes a big difference, okay? A lot of times, too, we're building strength for modern class, jazz class, doing push-ups, and guess what happens? Right? My back hurts. I have to go to PT. Okay? So how do we prevent that? Finding your core. Is it harder work? Just a little, right? It's a little harder work. But it's worth it. Yeah? So it's training your technique just like we train our technique in ballet. We have to work at it. We have to be mindful of it. But I'll tell you what, if you build these deep muscles like this, your technique building in class is going to be a lot easier, and you'll have a lot more power. I will tell you that personally, I started Pilates toward the later part of my dance career, and it changed it a lot. Not making up stories, I could jump higher, I could balance, I could turn better. Turns that were my nemesis, my left side, namely. I could do those front attitudes. You know what I mean? Like things that are so hard. A lot of times it's because we're falling back, right? And if we train our center, we can be up on our leg, and it's just there. Okay? So any questions so far? So we're going to move to the hip. Everybody found their core, right? Good. Okay, so then we're going to work the hip. And remember those deep muscles. And again, positioning is everything. So you're going to lie on your right side. And we can face the mirror. That'll be fine. What time is it? 2:14. Good. Okay. I'm going to keep you guys here all day. No. Okay, so let's face the mirror, and you're going to bend your knees at a 90-degree angle. And lie all the way down on your arm, like that. Okay? And then your knees are still going to be at a 90-degree angle, but your feet are going to be in line with your sit bones. So, yep. And then your ribs and your shoulders, come back here more, your shoulders and your, ribs and shoulders are going to be right over your pelvis. So if I had a pencil on the floor, oh, there are lines on the floor. If you guys want to line up your head and your spine and your feet onto a line, that would help. Don't want to? Okay, fine. There's one right here. They're between every Marley. Good. You can use your top hand for balance. Good. Okay. Nice. Good. Okay. That looks good. So now you're going to create what I affectionately call the mouse house, which is, good, your right waistline should lift so a little mouse could slide right underneath there. And you guys all have different hip bones, so you're going to have different size mouse house. Okay? Shoulders are down, and find your grounding. But either way, you should be able to slide your hand underneath your waist. Lift up, lift up, lift up. Hey, there you go. Good. Keep that. You can use your top hand for balance. That's fine. Good. Beautiful. Good. Shoulder blades down the back. And I want you to find that feeling of grounding. Ribs in. Lift up. shoulders down. I know, all that stuff. And I'm just gonna make sure you guys are in good alignment. Good, now try not to compress. Elongate, elongate, good. Good, so now, easy, right? Now all you're gonna do is a little turnout. So from your top leg, you're gonna rotate out and back down, and you're not gonna collapse on your side. You're gonna keep your mouse house and stay lifted, and I want you to do as big of a turnout as you can without twisting your spine and without moving your hips, shoulders, waistline up. Now go, Betsy. There, different, yeah? Keep your right oblique lifted, and I want you to find the deep 6. Remember how deep they are? They're in the ocean. There they are. Did you feel that? Okay, I have to hold you. Okay, keep going. You might not get to the turnout you're used to. Pull the ribs in, shoulders down. Now go. Better. Work as deeply as you can without arching your back. You guys feel it? Okay. Now lift your foot. Oh, don't rock back. There you go. Now lift your foot with your knee so they're parallel to the floor. So if you look in the mirror, I want your foot and your knee parallel to the floor and back down. Parallel up, just hip height, and back down. There. So it's not about how big you go, it's that you stay parallel. Good, and that your hips stay stable. Lift, there, ribs in. Good, and down. Parallel up. Better one. You feel the difference? Mm-hmm. Good. Now lift up only to your hip height. Right in line with your own sit bone. And I want you to pretend there's a pencil on your kneecap, and you're going to draw the size of a softball. Circling around without your hips moving. No twisting your spine. Lift up. Yeah, you killed your mouse. Don't kill your mouse. I know some of us are afraid of mice, but we don't want to kill them. There, ribs in, parallel. Now go. Little, there it is. Good. You can change directions. Your hips should be burning. Anybody? Good.
I feel like it gets into my quadriceps a lot.
Okay. No, you want to be here, sweetie. So, let me help you. Good question. There. Now, you're going to lift the knee up towards your chest and straighten it down right below your sit bone. Lift it up to your chest and down to your sit bone, straight leg, without moving your pelvis. So I'll use your leg. So it's going to go comme ça, like parallel passe, and then straight leg down. Parallel passe, straight leg down. No moving your pelvis. Use your core. Y'all feel those deep hip muscles? Good. You still like me? It's okay. You don't have to. Okay, now pull your knee up and twist away to stretch it. Oh, thank goodness. Okay. I know, it's a love-hate relationship. It's okay.
Okay, so who was burning just then?
Yeah.
How many?
Oh, yeah.
Everybody.
This, you have to turn this up, right? Is that...
Yeah, you have to not use your hip flexor. So remember, all the deep 6 muscles are way down here. So this is why we're doing the small little motions. We're not doing big, right, to find them. Now you found them, okay? Let's stay facing the mirror, but turn around. And do that on the other side. Backspin. Breakdancing. Okay, find your neutral spine. Find your mouse house. Feet, hips, ribs, shoulders, head in one line on the floor. Okay? Good, mouse house. Pull your feet back in line with your sit bones. Good. And now you're just going to start with your turn out and down. So feet stay together. Turn out and down. Watch in the mirror to see if your hips are shifting. Stabilize your shoulders by pulling the shoulder blades down the back. You squished your mouse. There and down. Good. Turn out. Better. So you have to keep your obliques firing in order to find your deep six. Guess what's working if you don't? Anybody? Hip flexors or? Bully on the playground is piriformis. Yeah. Yeah, so we want deeper than the piriformis. Lifting more. Good, so that's a neutral spine, so you're not in a side bend. Good. Now lift the foot with the knee. Parallel up, parallel down. Not too high. Parallel up. That's better. And you see, oops, I'm sorry. You see how everything is neutral. If you guys just keep going for a second, do like 3 more and then do circles. If you lose your mouse house, what happens to my spine? I'm in a side bend. I'm not neutral. So you're really keeping a neutral spine on your side. That's what we're doing. Do about 8 circles in each direction. Not too big. Keeping your hips stable. So, there. It's like a wall behind you. Yeah. Just 8. And then you'll lift up for parallel passe and extend your leg. There you go. You okay? Uh-huh. Good. Pull that belly in. Good. Yeah? Now, pull your hip. There you go. Ribs in, shoulders down. Try not to move your spine. Pretend there's a wall behind you. Nothing moves but your leg. Right. Like you have Barbie doll legs. Right? You're just moving from your hip joint, not your spine. Lift up. There, now from here. Deep, deep, deep in your hip. Way back here. Better one. You find it? Yeah. And then when you're done, twist, stretch it out. Okay? Woo! Breathe. You guys feel that? Good. If you want to lie on your back and do a figure 4 stretch, you can. Pull your knee to your chest. Stretch them out. Yep, and you can lightly rock side to side. Yes. Good. Like crying like that baby? I know. Yeah. So, but you'll be so happy when you stand up and your standing leg is stronger. Because that's what we're going to do next. So, let's have everybody stand. And you can shake your legs out, shake your hips out a little bit. Okay. And actually, just walk around in a circle for a second. Everybody just walk, walk, walk. Walk, walk, walk. And I want you to see if you can feel your hips stronger. Are you standing taller? Do you feel more supported? Does that make sense? So just check in with how your femurs are feeding into your hip joints. And then walking back to your place. So, what do you guys feel? Anybody? Say that louder.
It feels more underneath more than usually when I'm walking. It's all up top.
Good. That's perfect. It feels more underneath, right? Everybody kind of feel that a little? Those are your deep six. And when they're firing and they're strong, it's like you're like floating. You're like, whoa, I can, this is also how we jump higher, because there's that strength, and it's a deep, deep strength. Okay, anybody feel anything else they want to share?
Stable.
Very stable. Like you're just solid. Yeah. Yeah. Yeah, that's basically it. And it's taking the time to find them. And then these are simple exercises, right? It's not rocket science, but it's your alignment. Your alignment is key. You notice if you're on your side and you're collapsing your waist, you could probably do 100 of these, right? What's wrong? What am I doing? This is boring, But as soon as you're in the proper posture, all of a sudden you found the muscles. So that's what I mean by, if you get used to looking at the bony alignment and you find the proper alignment of the skeleton, 9 times out of 10 the right muscles will be found and worked, even if you don't know. You know what I'm saying? Train your eye to see that. That'll be good. So we'll do a little bit of standing balance, and first we're going to work in parallel. So everybody come into parallel, and we're just going to have parallel lines. So arms out to the side. And I want you to find grounding, meaning plant the soles of your feet, lift up through your inner thighs, lift up through your pelvic floor, find that transverse, ribs in neutral spine, right? Shoulders are down, spine is long, and now just a little transfer to the left, and you're going to do parallel passe, hold, hold, and now pull the deep six into that standing leg, hold, just in flat. I promise we won't go releve yet, okay? Gently bring it down, find grounding again. Lift up from your core. Your core picks your leg up, not your hip, right? Hold your balance, ground down through your foot, and lift up through your center. And transfer down. We'll do that one more time each side, and I want you to feel your inner thigh pulling you up. Good, stay there. And now let your hip go. Oh, that's wrong, right? And now pull the deep six in, hold, press down, just take a little releve. Aha! Down, change sides. So find the back of the leg, okay? And your inner thigh pulls you up, parallel passe. Good, find your grounding. Find the back of the leg. Oh, I'm sorry, let your hip go, right? And now find the back of the leg. And now lift from the back of the leg. Any amount. Ooh. Down. Set the leg down and relax. A little different?
It's almost harder to sit in your hip.
Hooray!
I mean, it's harder to find that it wants to come back to
Good.
straight.
Oh, that's perfect.
Interesting.
Because, and can you think of why?
Well, I think they're engaged now. I mean, that's sort of
Right.
active power before.
Exactly. So if you engage them, if you work them, and how much time did we spend on that? 10 minutes? Maybe 15? Not very long, in other words. And they're firing to the point where they don't want to let go. They want to play now because they're not wallflowers anymore. The story is complete. Oh my gosh, we should write a children's book. The story of the wallflower. Okay, let's try turn out. So same thing in turn out. And now let's use ballet arms second. Good. Find your grounding. So ground down through the feet. Lift up through your inner thighs. A little turn out from those deep six. So find those guys, right? And now, passe up. Find the back of the leg. Find your core. Narrow the waistline. Hold. Beautiful, you guys. Slide down. Transfer. Find the back of the leg. Lift from your center. Pull in that transverse. Tall spine. Good. And gently down. Good. And now hold here. I want you to find that turnout from your deep six in straight legs. Okay? Almost like your hamstrings could touch behind you. Arms out to the side. And you're just going to lift your belly, releve, hold, pull in through your center, and take a little coupe. Balance. Find the back of your leg. Releve. Find the back of your leg. Coupe. Releve. Down, plie. Whew! Okay? No problem, right? So then if you try, for example, turn or, and you have that idea of, that's standing on the back of your leg. If you hear that and you don't know what that means, that's what that means. Stand on the back of your leg. Lots of times dancers, you go on releve and it's all your quad. You're standing up on your quad, and the back of the leg is just it's not even working. It's just out there. But if you are on your leg, that's what it means to be on your leg. It's almost like the quad can lengthen. Does that make sense? Yeah. So, any questions on that? Nada? Okay. So, have all of you done like a single pirouette? I know you guys have. Betsy, come on. Okay, we're going to try. You have? Yeah. Most of you have. So we're going to do that because I want you to see what it feels like to turn. And actually, before we do that, the sun is in my eyes, so I'm going over here. We're just going to have arms out in second. Find those muscles again. And we're going to just do tendu to the side. And then we're going to close front. Tendu to the side. Now find those muscles to close back. Tendu side. Close front. Tendu side. Find those muscles. One more. Lift taller. Open. Find those muscles. Change sides. Tendu. Close front again. Tendu. Find those muscles. It's almost like the hamstrings scissor together. But it's the deep six. Do you guys feel that? That's what you're using. And that informs the foot. We talk about brushing the floor, right? It comes from your hip. Not necessarily your foot. I mean your foot too. But, okay? Rest. All right. So what you're going to do is fourth, you're going to do half turn fourth. Half turn fourth, 2 times half turn fourth, and then you're going to do full turn fourth. Just a couple times. I don't care how many you do. It's not about, oh, I'm a super turner and I want to do 10. It's about the half turn especially. Find your standing leg, land. Find your standing leg every time. Okay? Right first, and then we'll do left. Okay? So open. Fourth, find your leg half turn, land. Find your leg half turn, again. Just half, land. Batter. Just half, go to full. Turn, find your leg, land fourth. Find your leg, Land fourth. 2 more. Find your core. Better. 1 more. Find your core. Ribs over hips. Rest. No, that was good. That was good. Good. So we're putting it all together. That's why I wanted to just try some turns, because you have to, right? The deep hip, the deep core. That's going to keep you, you see people land like a feather? That's why. Other side. Our favorite side. You ready? Open. Fourth, half turn. Land. Half turn. Land. Get your core. Take it with you. Land. Good. Half turn. Beautiful. Full turn. Around. Keep your center. 3 times. Belly in. Land. Good. 1 more. Belly in. Better. Rest. Shake your legs out. Very nice, you guys. Anybody notice a difference from usual?
Yeah. You can stand on it.
What's that?
You can stand on it. Yeah.
You can stand on it. Yeah. And it is a bigger difference. I mean, it's a big difference to stand on your posterior leg, the deep 6, than standing on your quad. If you rely on your quad, you know, you don't have that confidence. Maybe you make it, maybe you fall. Maybe you make it, maybe you fall. Right? But do we want to go on stage like that? It's like, gonna make my turn. Do you know what I'm saying? Like, you don't want to go on stage like that. So, finding these muscles and working them is going to make a huge, huge difference. Also, just in the power. When you're going from floor to standing to leaping, right? How do you do that? So, for example, you guys know, any roll you do on the floor and you come up from your knee. If you come up from the back of your leg, same thing. I don't know about you guys, but I did a lot of Horton training, and I really am not going to do this right now, but you could try it if you want, where you go from the floor to your belly, and you come up to standing from there, right? Which I'm not going to do. Or you cross and you come up to standing, but then you go to a T-turn or something like that. Do you know what I'm saying? Like, that is never, ever going to happen in a million years unless you find the back of your leg. So, what's a simple transition on and off the floor that you guys know? Anybody? Do you do that?
We do that all the time.
Just, can you show one?
A simple one?
Simple. Simple, simple, simple as you can, so everybody can do it.
Simple one would just be simple.
Okay. Do you have one where do you guys roll to stand? Roll to stand. Okay, how about we do that?
Okay.
So when you roll, you're going to tuck your back leg. You're going to roll on the floor. And now here, I want you to find the back of your leg to stand. Go back down. Roll. Find the back of your leg to stand. Okay? So let's do that a couple times. That makes sense to everybody? Also use your core. Ready? So we'll go down, we turn, stand on the back of your leg. We go down, roll, stand on the back of your leg. Now find your core. Do that again. Down, find your core, and now lift your core up. And again, down. Don't use your hands now. Lift. One more time each side. Don't use your hands. Use your core. Stand. Now we're having fun. One more time. Down. And good. Okay? Kind of, sort of? I know it's hot in here. I'm sorry. Okay. So those are just a couple of examples. You just find it everywhere. Challenge yourself to find these muscles, whatever style you're doing, whatever class you're doing, whatever technique you're doing. Because maybe you're doing ballet, maybe you're doing jazz, maybe you're doing Horton, maybe you're doing Graham, maybe you're doing African. You know what I'm saying? It doesn't matter. But if you find the depth of your hip, the depth of your core, it's going to go a long way toward taking care of your hips, your knees, your feet, your back, your pelvis, SI, a lot of things. But it's that mindfulness, yeah? Yeah.
Do you have suggestions for cueing your imagery with doing a lot of vertebral extension? I feel like that's a really hard cue for people to not hinge at just one spot.
Yeah, for sure. For sure. That's a good question. So let's do what we call a mini swan, and then we'll stand up and we'll do cambrai. So everybody's going to lay on your tummy with your legs long. And let's do this. Let's do hands under your forehead. And now instead of planting your tailbone, you're going to plant your pubic bone into the floor. So not so hard that you hurt yourself, but just lightly plant your pubic bone into the floor. And then extend your legs long behind you. No, they stay on the floor. Sorry. Reach back to the back wall with your legs long. Good. Oh my gosh, that was beautiful. Okay, and now find your transverse. Narrow your waistline. Draw your shoulder blades down your back and find your grounding. Good. Now keep all that and lightly bring your hands under your shoulders. Good. And now I want you to pretend you are in the desert, and you're going to drag yourself across the desert forward towards the mirror and just lift your upper back a little bit. Yeah, so just like a cambrai, you're going to lift, but your bottom ribs or your ribs are going to stay on the mat. And I want you to drag yourself forward, lengthen your spine, and then gently come down. Good. And again, keep your pubic bone planted, lifting up. And I want you to pretend I could slide a spatula underneath your belly. Yeah. And then as you come down, lengthen forward. Good. Couple more. Bend your pubic bone. Good. Keep your low back long and bend your upper back. So now your door hinge is at the bottom of your scapula. Nice, Betsy. I saw that. Good. So, yeah. Right across your mid-back, that's where you're bending. Beautiful. Good. Keep this long. Open. Aha. That's excellent. Yeah? You guys feel that? So it's an elongation in your spine, and then you're bending right about your TA. Now, come to standing. And let's use the bar. There are not too many of you. You can use the bar over there too if you want. And just stand in a first position, facing this way. Okay, so your right arm is going to go up. So this is just a simple cambrai. And as you hinge, I want you to lift up like you're pulling yourself across the desert again. And then lift and hinge from your scapula. And then come back from your core. So I want you to try that a couple times and pretend you're on the floor and pretend you could slide a spatula underneath your belly. Beautiful. Good. Yeah. Couple more. From your upper back. So lift your sternum to the sky. Up. Ooh, that was nice. So it's almost like if you have a partner and they're literally lifting you up from your scapula. Does that make sense? Lift up. There. So the more you lift in your transverse, so come back, the more your low back is supported. Good. Now. Oh my gosh, look how far you went. That feel okay? Yeah. Good. So stay lifted. Do that again. Beautiful. That's stunning. Lift. Yeah? Pull up more, more. So here, pull in. And now lift your chest up to the ceiling. Oh, there you go. Ribs in. And there you go, back further. Almost hitting your friend back here. One more. Lift up. And now as you come up, lift taller. Do one more time. Lift up to go back. Good. Sternum up to the ceiling. And back up. Better. You got a little flush when you did that. Okay. Rest. Did that answer your question?
Yeah.
Yeah. So that little, what we did on the floor is called mini swan. And what you're doing is you're learning how to bend from your thoracic spine. And you're not bending from your lumbar spine, right? And it's that idea that you're being lifted from your sternum to go back. So then there's elongation in your spine. There's not compression. So if we don't lift and we just go back, there's compression. It hurts. That's why, a lot of people hurt their back. But it's literally lifting your spine, and then there's space and there's room to extend. Yeah? Good. Good. So any other questions? 'Cause that's what I have for today, but if you guys have anything else you want me to talk about, I'm more than happy to.
I know for me, I don't know if it's just genetic because my dad has hips like this, but it always feels like they're rolling over one another. Like in a Tabletop, or like if I'm just sitting here, like I can actively hear all the pumping. And it feels like my hips are just like the bones or something. So that's why like foot kids have always been
like so it's hitting on something?
Yeah, it always feels like stuck.
Yeah, let me see you stand. Just stand. So it doesn't look like you do this. I don't know. I mean, you would need probably a full evaluation to really know of your hip. But a lot of times what happens is that the head of the femur can pop forward, and then it can rub on either your muscles, like your psoas, called snapping hip syndrome. And what you want to do is like what you were talking about. We want to center the femur over the middle of your ankle. So if you guys touch like right in front of your ankle, the highest point on your foot, that's where you want your hip to be centered over, the highest point of your foot. So if it's too far forward, it's going to rub on stuff, or like whatever. It doesn't matter if it's a ligament or a muscle or a bone, or it can be a number of things. But that might be part of it. I don't know. But there's this idea of softening the front of your hips back, almost like a little internal rotation. So if you guys put your hands on your hip flexors, especially dancers with hip flexors that won't let go, like yours, we end up popping forward into our hip flexors. And if you soften the hip flexors and gently, it's almost like a gentle internal rotation, that'll soften them and bring your head of your femur back centered over your leg. And then, whether you're turned out or not, there's space. Where'd my bones go? So if this is you, and the femur can literally slide a little bit so that it's hitting on, this isn't a super smooth surface. It can come into the bone and get caught up when you're doing rond de jambe or, your fouette turns. So it's almost, this is a huge exaggeration, but it's almost like pulling the head of the femur back so that it can sit in the center of the acetabulum, and then it can glide.
So that slipping forward is also what causes labral tears, right?
It could.
That's what I've got going on, I think that she said it was the same thing. My hip with my femur was too far forward, so it was hitting on the labrum.
Yeah, because the labrum encompasses the head of the femur and holds it. I mean, those muscles aren't the only thing that holds your femur in. Your labrum holds it in, and so that is that connective tissue there. So if there's rubbing against the bone, yeah, it can cause that tear. This is upside down. Why didn't somebody tell me that? You guys are supposed to be telling me that. I got my tired moment again. This was completely upside down. Okay, this is your hip. I'm glad you didn't notice either. But does that answer your question? So it's hard to know without having your hip tested.
Is it on both sides or just on both sides?
Yeah. And sometimes our hip stuff is genetic. People have narrower hips, more flexible hips, less flexible hips. You know, everything's genetic to a certain extent. But if we train our genetics properly, we will take care of our joints. And that's the most important thing. The most important thing is not how high your leg goes. The most important thing is that your pelvis stays stable. That's why, you know, if you see a really beautifully well-trained dancer, it doesn't matter if their legs are down here all the time. It doesn't even matter. Their hips are square. Rather than a dancer, their legs are up there, but oh, their hips are too. And you're like, what are they doing? I'm sorry for them. You know, it's true. It doesn't matter how high. It matters that we have stability. And that also happens to create a beautiful aesthetic. So you guys know that dance is one of the only things that is an art and a sport. It's both. It's not just one. And we used to get pushed in with the basketball players and the hockey players. And yes, it's athletic. Yes, it's a sport. But it's also an art. But it happens to be that if we take care of our joints and our form, then it also informs the aesthetic. Yeah? So that's nice. 2 birds with 1 stone. Yeah. So thank you very much for coming. If you guys want to have the schedule or postcards, you're welcome to grab some. And if you have any other questions, you can, I'll just, here, take one and pass it around.
Do you have any source online or anything of
Take one and
those
pass it around.
exercises that we
That's what I was just going to ask. Kind of a summary of before class, what could be hit to access everything that you discussed.
Well, you know, I am teaching faculty for Balanced Body Pilates training, and we have podcasts on our website. I did a whole podcast series for Pilates for dancers. So that is online, and it's on the Paragon website. So if you guys want, I'll give you one of my cards too, and you can access those videos.
This will be posted.
So do 1, 2, 3.
Oh.
The Dance Medicine Foundation is posting every Ask the Experts, segment, and so is Meredith on there yet?
No.
It is. Okay. So the previous 2 are on the website already, and then this one will be on in the next few weeks or so. Yeah. Yeah. Okay.
Before class.
Yeah, right.
All right. Thanks, you guys.
Thank you.
Have a lovely afternoon.
So I had like issues.